Dr. Colin McCharry from Molechex. I'm a skin cancer specialist doing it for many years. Initially started in Queensland Health, QE2, PA, Malta and Royal Brisbane Hospital, and all of those are smaller hospitals that you can imagine. I left them in 2013 and I started the private practice and got my subspecialty in skin cancer surgery, dermatology, laser, dermoscopy and all the things related to the skin. Technically speaking, I breathe and live with skin. In Molechex, when I joined them in late 2021, I have tried to develop and bring and evolve lots of technologies for treating the skin cancer and all of the related skin conditions effectively and innovatively. Nowadays, we are using stem cell treatments called Factor 4, which is a TGA approved treatment and pretty much with very good efficacy for treating of small wrinkles to large areas of skin involved with allergy, with other skin conditions. It's very effective for hair growth and also happily helping the patient continuously for growing collagen and just reverse this glorious process of aging. I'm also a laser consultant and specialist. I do vascular laser, I do cosmetic laser, medical laser and laser for cancer. So this is pretty much innovative, and for me, working in different renowned dermatology clinics all around Brisbane, always fascinating to treat my patients with the least invasive and very effective sort of treatments, which is non-surgical and most of the time around 98% effective. Also, laser is very effective for skin conditions including redness of the face, we call it rosacea. It's effective for conditions like acne, the pimples of the face. It's effective for aging, resurfacing and obviously even facelifting. The other sort of treatment that I made myself involved over the years is soft surgery. That is basically using electrosurgery to treat skin conditions that do not need to be cut and stitched. Don't get me wrong, I'm very good with cutting and stitching as I've been doing it for plus 20 years, but my intention all the time is to go for least invasive and most effective treatment with little to no downtime. Now, soft surgery by using our devices is pretty much like a dream. I made myself trained in London with a very good oculoplastic surgeon with techniques of the electrosurgery and got great results in the past 7-8 years treating these conditions and lesions, unwanted moles and stuff with minimal to no scar on my patient's body and specifically the face. The other sort of treatment that I have invested a lot is using natural fillers. Yes, although I'm a board member of Austroasian College of Aesthetic Medicine and I've got fellowship in the international field of advanced aesthetic science, and I've been using the Botox fillers sort of injectables and stuff like that in the past 20 years. We just try to move towards all natural, all you treatment. As I mentioned earlier, Factor 4 is great for that sort of treatment, but at the same time, we have invented a TGA approved gel, comes from the patient's own blood, and we call it albumin gel, and it lasts between 3 to 6 to sometimes 12 months, depending on the viscosity and the texture of that. This way, you can have a filler without having any chemicals in your skin or in your body. What could be better than that? Finally, the skin cancer surgeries. I have started my first skin cancer surgery around 2011 as a plastic surgical registrar in the PA hospital. Through the years, with lots of training and lots of sort of ups and downs in the science and in the field, we have learned lots of new techniques, lots of surgical procedures that actually gives our patients very good results, least amount of scar, and at the same time, we make them cancer free. In my job, I'm quite happy to tell you that we do a full range of service. We diagnose and assess and then start the managing of skin cancer. So if that needs a surgery, well, we've got a very advanced theatre and we would be able to just do it under local anesthetics, we can use sedation for our anxious patients, and we can also use a Suven needle-free injection for the anxious patients who do not like the needle. And guess what? It's a very common condition. After the surgery, we always make ourselves proud to have a comprehensive care for our patients. We give our patients written aftercare. We predict most of the situation, but at the same time, because we're not a fortune teller, I always leave my work mobile phone number for all of my patients in case anything happens. I would be pretty much contactable and look after them. Come and see us in the Molechex. We would be proud to look after you like the clinic was in the past 17 years, and we are trying our best to get the best results and make you happy in the skin you live in. Thank you.